worries. The competitive world has given us a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely.
Namaskar, sir.
Namaskar ji.
So, welcome all viewers, especially from different parts of the globe, from UK, US, Australia, Europe, and India. So, generally, we'll take all your questions for autism, but today's live is especially for Parkinson patients who have been waiting for so long to connect with Dr. Navdeep Sharma, sir. And finally, they got the opportunity. So, we'll start with that. So, welcome, sir.
A very warm welcome to all of you. And yes, definitely, we are having Parkinson's patients who approach us around the globe. And the most important thing for us is that generally, when we talk about Parkinsonism or when we talk about Parkinson's disease, now that affects people in the middle or older age group. That means by the time a person starts showing signs of Parkinsonism, he already is not that much active socially as he used to be. And at that time, support of the family is something which is really very important for that person. So, yes, Parkinson's is a condition and Parkinsonism is a disease which needs utmost attention. And when we talk about Parkinsonism, Kampavat in Ayurveda, there's a lot that Ayurveda can do for this disease. Yes, Gauravji.
So the first question is, sir, they are asking about they having the tremors and they are unable to walk. So they want to know that is it disease curable? Can I get reversible?
Do
Because
you have
I'm
the
on the
name?
meds. Mr. Swastik.
Mr. Swastik. And I also saw one history which was forwarded our way, Gauravji. If you can help me out with that history. Yes. It is from Dr. Meenakshi. Dr. Meenakshi, I hope you are there with us. And I am directly starting with your question because being a doctor, it will be easier for me to be updating you on how we need to do the things, how we do it in Parkinsonism, and what exactly you can expect from us. I have been updated that you are a retired gynecologist and you have been taking allopathic treatment like Sindopa from last 3.5 years. The problem is in walking, having bradykinesia now. And what I would like to tell you over here is that, see, when we talk about Parkinson's, you are yourself a doctor. Now, the neurotransmitters like dopamine are not being produced in the requisite quantity in the body. And yes, in allopathy, we believe that once this situation arises, there is no way in which again the neurotransmitter in the body can be generated in the required quantity. That is why we start with artificial neurotransmitters. We start with dopamine in the form of Syndopa. It is basically artificially or externally utilizing neurotransmitters to give a temporary improvement. And yes, at least in 60-70% cases, there is a good improvement, at least initially for a few years with that. Then gradually, the dosage of Syndopa goes on increasing. And since it is levodopa that we are giving, so that dopamine directly isn't being released in the body, because dopamine, if taken directly, will cause a lot of body stiffness. So, being a doctor, you must be knowing that yes, it's levodopa, which changes into dopamine in the required area of action crossing the blood-brain barrier. So yes, that is being done over there. And
So we have history.
yeah,
of Meenakshi.
yeah, I went through the history.
Yeah.
That is why, luckily, by the grace of Almighty, once I go through a history, so that's the power of Ayurveda. At least it stays in mind for quite a long time. So I was talking about dopamine. And then to reduce that stiffness, to reduce the side effects of dopamine, a lot of other medicines are added along with that. When we talk about Ayurveda, I've been updated that you want to know about the herbs in Ayurveda, which can help a person come out of Parkinsonism. What I would first of all like to tell you over here is that Parkinson's disease, as per Ayurveda, is a lifestyle disorder. It has been gifted to mankind more by the modern stressful life, dietary changes over the years where we have started taking fats, desi ghee as our enemy. We feel that if we are taking desi ghee, it is just going to increase the cholesterol level, it is just going to cause heart problems. Although now scientifically it is proven, and the allopathic world also believes that yes, taking external ghee is not going to increase the internal cholesterol. But despite that, 80 to 90% people feel still that no, ghee is not to be consumed. So as a result of that, what is happening nowadays is that neurological conditions are increasing, and Parkinson's is one of them, where there will be stiffness, there will be trembling in some cases, there will be voice related problems in some cases. These common things are going to arise. But when we talk about Ayurveda, when we talk about Ayurveda for Parkinsonism, it becomes very important for us to realize that if we are to use Ayurveda for Parkinsonism, and if we really want to come out of this disease, it is not just herbs that we need to be using. More importantly, it is the Ayurvedic diet, and if possible, Panchakarma, where patients come to us, they stay with us, we do some internal and external Panchakarma therapies for them, and luckily, the best part of Ayurveda in such cases is results are very quick to come. And when we talk about a medicine, some herbs which are good for Parkinsonism, I would like to share a combination with you. Its name is Park. Now, Park Care is a special Ayurvedic combination which is developed by us, and we have utilized some major medicines in it. When we talk about major medicines, these are the medicines which work on the neurotransmitter level, like Jyotishmati is one of them. You can carry on with another video of Park Care. I would like viewers to have further details of Park Care. So you can carry on with the team. So when we talk about Park Care, then Manduk Parni which we use, it is Kevanch that we use, Conch, Mucuna. It is Kevanch which is considered as the natural precursor for dopamine synthesis in the body. In Ayurveda, it is also known as Kapikachu. And then there is Kampavatari Ras. Kampavat, as I just mentioned, Parkinson's. Kampavatari Ras is a herbo-mineralo-metallic combination which really works very quickly towards alleviating the signs and symptoms of Parkinson's also. So, if we talk about herbs, Jyotishmati is one of them, Manduk Parni is one of them, Kapi Kachu is one of them, and if you talk about a herbal combination, Park Care is a very safe and an ideal combination which can be taken by any Parkinson's patient very safely, and if it is synergized with the Panchkarma which I am guiding you, then the results are very quick to come. I hope, doctor, that provides you insight, and I would really love to answer any further question coming this way from your end. Yes, Gauravji.
So we have a next platinum member with us. The details given from Sanjana. Name is Shubhradita Mohanty, and their existing patients. CP want to know about how long she have to take the medicines because hyperactivity on and off, and there is they have started treatment from June 1st, 2023. Current medicines which are going, sir, Breno are 10 ml in the morning and 15 ml in the evening, and 20 ml, 15 ml in the afternoon and 20 ml in the evening. Cucurbit oil, 8 drops morning and 8 drops
What
evening.
about the ABA sessions, Gauravji? Who is doing the ABA and how many sessions?
ABA session going with Rahul, sir. 37 ABA session done, sir, till date.
So, Mr. Mohanty, one of the biggest challenges which I see over here is that it is 37 sessions till now, and if we talk about the time frame, we started in 2023. We are now approaching the ending of 2025. The minimum required sessions, the minimum required, I am talking about, of ABA in any child are one session per week, where the parents are really very active in taking the training and everything. That makes it 4 sessions minimum in 1 month. That makes it 48 sessions in a single year and approximately around 100 sessions in a year. And we are there at 37 sessions, I suppose, Gaurav just updated.
Right, sir.
Now, the biggest challenge lies over there. What is the age of the child?
So the child
6 years and
is
10 months.
yes, sir. 6
So,
years.
as I can see, the age is 6 years and 10 months. It becomes very important that, see, at this age, it is the trainable age for your child. Your child can be trained, but for your child to be trained at 6 years and 10 months, approximately 7 years, at least bi-weekly ABA sessions with us or weekly ABA sessions minimum. Many a times the parents tell us that, see, we are taking sessions from outside. The challenge for us is, the problem for us is, I won't say 90% cases, in 100% cases, when we go through the videos of those centers, it's occupational therapy labeled as ABA. Team, check if we have the slide for ABA and occupational therapy. I'll check if I can show it to you for further details. Now, ABA and occupational therapy are entirely different things. So let us first talk about OT. Now, when we talk about OT, as you can see on the screen, OT is a command-based therapy. Like, place green with green, green के साथ green लगाओ. Which one of these is rectangle? Rectangle के साथ rectangle लगाओ. चलो ऐसा करो, चलो इसको निकाल करके रखो. This is a common thing in occupational therapy. Now let us come to ABA. Now when we talk about ABA, ABA again is two types. We create situations generally in ABA, but ABA again can be a command-based ABA and a non-command based ABA. Let us talk about a command-based ABA. We place a chocolate on a refrigerator. The child is pointing out towards the chocolate and we tell the child, ऐसे नहीं दूंगा, पहले बताओ क्या लेना है आपने, क्या है फ्रिज के ऊपर. Now this is command-based ABA. And the non-command-based ABA, someone else will come. We will ignore the request of the child by pointing out or holding our finger and going towards the refrigerator, and someone else comes and say, chocolate, chocolate though, chocolate, chocolate, give me chocolate, and we will give that chocolate to the other person who is asking for the chocolate, and he will eat the chocolate in front of child. Chocolate tasty hai, chocolate to bahut achhi hai. Now I know when this will be done, the child may start crying, the child may start showing tantrums. But if we really want a child to speak, if we really want a child to come out of everything, this kind of non-command based ABA, depending upon the child's behavior and after studying the child's behavior in a proper way, needs to be done and carried out. Now that is the challenge over here. That since we generally leave our children at therapy centers, nobody is going to this dedicated work for our children. Back over here, I take so much efforts and time to train psychologists. It's not that on the first day when they join our organization, they know what needs to be done. But gradually, when they are given training, they are guided, they gradually come to a stage that they are able to train the parents further that what exactly needs to be done. That's why, Mr. Mohanty, if we really need that these ups and downs of hyperactivity going up and down are no longer coming, and we are watching a regular and a good paced progress. Bi-weekly ABA now is very important in your child's case. So please go ahead with that. Don't ignore that. If you feel it gets tough for you to do it at your home, you're welcome to be at our center and we'll do that for you. Yes, the next question, Gaurav.
Thank you, sir. So we have next Miss Vaishnavi Mishra ji, a new platinum member, and the patient ID is 425229 from Ashima. Details are, sir, Medansh, age is 6.9 years, parents from Uttar Pradesh, and treatment started on January 1st, 2023. Parents consulted with you, sir, 5 times via video consultation and visit Chandigarh meet 2 times. Current prescription is going, sir, Prenovar concentrate 5 ml in the morning, and Brenoir Hot Sip DS 5 ml in the night, Brenoir hot sip mild 10 ml in the afternoon, coconut oil 20 ml, 8 drops PD, and kidney care 2 drops PD, Kamaduda Ras 0.5 tab BD, and Vachadi Rhythm 2.5 ml BD. And enzyme not giving right now. बच्चे की भूख कम है, पेरेंट्स चाहते हैं कि बेटा खुद से खाए. 57 sessions done with psychological Rahul sir, and mother wants to add in the herbs for understanding, stubborn behavior, not using cognition, speech issues and emotionalness, and mother is concerned and wants to know the role of herbs and more inclined towards psychology therapy, as mother mentioned the child is getting settled with psychological therapies. And the history pointers, sir, present complaints 19 September.
That's good enough
Right,
for
sir.
me.
Thank you,
See,
sir.
when we talk about the psychotherapy, you are very right that the behavior modification will be done through psychotherapy only. But the herbs are so very important that if we do not give the herbs, the psychotherapy is not going to work. That is the beauty of Ayurveda, that the Sattva Vajja Chikitsa. What is psychotherapy? Psychotherapy is Sattva Vajja Chikitsa of Ayurveda. So when we are to do psychotherapy, it becomes very important that we harness the positivity of the child with herbs and then do the psychotherapy for the child. Single-handedly, in these 24 years, I haven't seen a single patient completely coming out of autism without this concept of Ayurveda synergized psychotherapy. So why do we need to take a chance with our child? The best part is Ayurveda is not harming our child. The second good thing is, yes, you are watching and visualizing improvements in your child. So when everything is going on in the right way, why do we need to do a new trial where we stop Ayurveda and carry on with psychotherapy? Because see, the life of all those children who come to me for treatment is very precious for me. Our entire lifespan depends upon whether we do it rightly or not. That is why I never believe in making trials with any child. What I did in my PhD, what I did in my research, what has worked for thousands of children is Ayurveda with psychotherapy. So that's what I have always been doing. And again, as I just mentioned for Mr. Mohanty, the number of sessions which you have gone for till now are lesser than, far lesser than what is required. If you are really enjoying psychotherapy, at least go for 2 sessions per week, not less than that. If you feel that the child is responding with psychotherapy, the major problems which you have shared with us, yes, they need behavior modification. Behavior modification has to come through psychotherapy, but for that to happen, you need to give the psychotherapist ample number of sessions. Less than 1 session per week? No, things are not going to work. If we want our child to learn something, if we want to educate our child, we daily send our child to school. Or do we do it that once a week, once in 15 days, we'll send child to school? If we do that, is the child going to study? A normal child will also not be able to study like that. If you go to a normal psychotherapy center, which is near your home, which says that yes, we cannot bring a child out of autism, even for that psychotherapy center, they will simply tell you, ma'am, if you want some results from us, you need to be there with us at least 5 to 6 days a week and leave your child with us for 3 to 4 hours daily. Yes, we are experienced people. Yes, we can, by the grace of Almighty, do it at your home, but we are not magicians. For us to work, for our concept to work, you need to be very well aware of this thing, that what we have been doing, we have guided you everything. If there are problems, there are so many herbs which we can change. We are again open to that. But the thing is, either you need to be working on the psychotherapeutic front in the proper guided way, or leave everything and come to us, be there with us for 6 months. We'll do everything for you and you will see all the changes which you want from us. But one of us has to do it, and that has to be done with full heart, consistency, and without gaps in the required levels which has been guided. So please do that, and then you will see no problems, and you will see that the improvements which you are already visualizing will further be very quick to come. Yes, Gaurav.
Right. Thank you very much, sir. So next question is Sir Risha Power. They are joined with us from Vietnam, and they are existing member for past 2 months. Hello, sir. My son code is 522074. I want to ask that from last 2 weeks he's not going potty regularly in weekdays, but in weekend he's going every day. Please suggest that I can do. Details from Ashima, sir. Avik, age 3 years of age, and Indian parents from Vietnam taking treatment since September 3, 2021 25. And Breno R concentrate 10 ml in the morning, 10 ml in the evening, sir. Mukta Pishti Premium 0.125 in the morning, pumpkin seed oil 4 drops PD, and 12 sessions done with Dr. Gurpriya. And improvement, school teacher giving good feedback, sitting tolerance is enhancing and getting better gradually, sir. Major concern, child is not passing stool in the weekdays since last 2 weeks.
Gaurav, have you been to Vietnam? Did you get a chance going
Not
over
yet,
there?
sir.
You should go to Vietnam.
Right, sir.
Vietnam is a nice place. Really good to go. Pho Quoc, a real nice place over there.
Right, sir.
So Vietnam is a very nice place, sir. And coming to the constipation part, please start with Babuna sachets, Babuna drops at bedtime, along with the rest of the medications which you are giving. We just need to add Babuna to make the bowel movements more regularized. And as is a common thing with parents, and I have been requesting other parents also, a bit more regularity on the ABA sessions. You are doing it, you are watching results also, but if we can be more regular with the ABA sessions, that is even more better for us. So Babuna drops at bedtime. Yes, next question, Gaurav.
Yes, sir. Thank you, sir. So Sameji is our silver member from past 2 months, and he's asking the coordinator is Mr. Tarun. And sir, is visiting Chandigarh is beneficial, and how it would help my son, and what will be the expense?
Samaji, when we talk about the benefits of visiting Chandigarh, there are no words to explain that benefit. See, we are having 80% of patients out of India. It's not easy for them to get visas. It's not easy for them to leave their country and be there with us for so long time. Still, they do that. They leave everything out. They come to us. And when the entire team is working for you, just feel that one of our psychologists, not the senior most ones, one of our psychologists connects once in a week with parents for approximately 45 minutes to 1 hour, and still the parents see so much results. When the senior most psychologists are working on the child throughout the day, directly working on your child and training you directly, Panchkarma is done to further increase the conscious subconscious coordination, that too daily. Outdoor activities are done and a lot many stuff is being done. You can't imagine the difference in getting a treatment, being there with us, and getting it done when you are at your own place. The best part is, why do you think about charges? Why don't you do it under insurance cover? We are NABH certified. We are amongst the very few Ayurvedic centers who are NABH certified. So if you are coming to our Chandigarh center, you are staying with us, you are taking treatment from us, all that needs to be claimed from the medical insurance policy, which you have already done. You will get the claim. There is no reason why they will not give you the claim. Yeah. Next question.
Thank you, sir.
Gaurav ji.
So details from Vasu is patient name Mayank, and date of birth is 7/6/2022, 3 years and 5 months, and existing patient started treatment since 14 August, and language हिंदी में जानना चाहते हैं सर. मेजर कंसर्न इज स्पीच इशू एंड हाइपर एक्टिविटी, एंड मेडिसिन दे आर टेकिंग ब्रेनोवार 5 ml मॉर्निंग एंड 5 ml इवनिंग, कोकोरबिट ऑयल 5 ड्रॉप मॉर्निंग.
ABA कौन कर रहा है गौरव जी?
वी डोंट हैव एबीए डिटेल्स सर विद अस.
देखिए वासु, आपसे ABA डिटेल्स हम एक्सपेक्ट करते हैं कि आप अपने पेशेंट के में जरूर बताएं. नाम क्या बताया गौरव जी आपने?
इनका नाम है सर मयंक.
मयंक जी, जैसा कि मैं बाकी पेरेंट्स को बता रहा हूँ, भले ही दवाइयों की डोजेज थोड़ी कम चल रही है, मैं ज़्यादा डोज चाहता था इससे चले, थोड़ी ज़्यादा डोजेज चाहिए है, थोड़ी कम चल रही, लेकिन कम डोजेज के साथ भी काम चल सकता है, लेकिन ABA सेशन मिस करके काम नहीं चल सकता है. सो प्लीज़ ABA पे कंसिस्टेंट रहिए. 3.5 साल के आसपास की एज आपने बताई है बेटे की, अपने आप में जो बच्चे हमारे पास 4.5 साल से छोटे आ जाते हैं, वहाँ तो पेरेंट्स के लिए हमारा ट्रीटमेंट एलोपैथिक ट्रीटमेंट से भी क्विक होता है, बहुत जल्दी रिजल्ट्स आते हैं। तो छोटा बच्चा है, इस बच्चे के केस में रिजल्ट्स बड़ी जल्दी आ जाएंगे, ये भी ये मिस मत करिए, वो बहुत ज़रूरी है, क्योंकि हम छोटी-छोटी गलतियाँ जाने-अनजाने में अपने घर में कर रहे होते हैं, जिन गलतियों के कारण रिकवरी की स्पीड जितनी हो सकती है, उससे रिकवरी की स्पीड जो है वो स्लो हो जाती है। तो ऐसा हरगिज़ मत करिए। जी।
Yes, sir. So we have Harshit Jain, sir, platinum member, and the child name is Sahaj Jain, coordinator Tarun, and Sahaj, sir, May 2025 से दवा और थेरेपी दे रहे हैं। अभी भी उसका अपने हाथों के को हिलाना बंद नहीं हुआ है। कब तक हमें दवाई देनी होगी?
एज
एंड
कितनी है गौरव जी?
एज है सर इनकी 11 इयर्स और 6 मंथ सर।
सर देखिए 11 साल 6 महीने सहज की एज है, 6 महीने से पहले मैं पूरी कोशिश भी कर लूँ, रिज़ल्ट्स नहीं दे पाऊँगा, क्योंकि एज ज़्यादा है। हाँ, रिज़ल्ट्स दूँगा ज़रूर, ये आपसे वादा है। मेरा वीडियो आपके सामने है, रिकॉर्डिंग के ऊपर आप बातें मानेंगे, तो रिज़ल्ट्स ज़रूर मिलेगा, और मेरी बातें मानने में बहुत कुछ नहीं करना है, एबीए को मिस नहीं करना है। आई होप आप एबीए सेशंस करवा रहे हैं, कितने सेशंस हुए हैं मुझे प्लीज़ बताएँ, लिखिए। और याद रखिए 11 साल से बड़ी एज है, थोड़ा समय लगेगा, दिल नहीं छोड़ना है। जब आप मेरे पास आए होंगे मैंने बताया होगा कि 11 साल पे हमारे पास करीबन 3.5 से 4 साल का समय हम पेरेंट्स से माँगते हैं। 11 साल पे हम इम्प्रूवमेंट तो दे पाते हैं, कई केसेस में बिल्कुल ठीक भी कर पाते हैं। ये डिपेंड करता है कि मैंने वीडियो एनालिसिस करके क्या कहा होगा और बच्चे की एमआरआई कैसी होगी। सो बिल्कुल भी डिमोटिवेट मत होइए। ये रिजल्ट्स जो मैंने आपको प्रॉमिस किए हैं, जितने टाइम में प्रॉमिस किए हैं, उससे जल्दी ही आएँगे। लेकिन आपने भी जैसा मुझे प्रॉमिस किया कि सर जो आप बता रहे हैं, मैं वो ज़रूर मानूँगा। मेरी आपसे विनती रहेगी, वो आपने अपना वादा निभाना है, मैं अपने वादे से बिल्कुल पीछे नहीं हटूँगा। जी गौरव।
क्वेश्चन है जो रेगुलर आता है पेशेंट्स का, जैसे कि मेडिसिन के लिए हमारी वेबसाइट पे जाते हैं, कई बार ये होता है कि हमारे कोऑर्डिनेटर से डॉक्टर्स कहते हैं कि आपने अगर कोई एक सिंगल मेडिसिन जो आप लेनी है तो हमारी वेबसाइट पे जा सकते हैं। तो पेशेंट्स का कंसर्न क्या आता है कि आपके एक प्रेनोवार है, उसमें डीएसपी है, माइल्ड भी है, तो उसका एक कंसर्न आता है कि प्रेनोवार कौन सी किस चीज के लिए यूज होती है और क्या आप चाहिए उसको।
खुद नहीं चेक कर पाएँगे सर आप, यही चीज़ आपको हमारे डॉक्टर से डिस्कस करना है, और देखिए हमारे डॉक्टर्स के साथ डिस्कशन आपकी एब्सोल्यूटली फ्री ऑफ कॉस्ट है। ब्रेनवार कई तरह की है, एक ब्रेनवार ओपीडी वाली है, वो ब्रेनवार वो है जो मैं ट्रेडिशनल आयुर्वेदिक मेथड से तैयार करवाता हूँ और वो केवल ओपीडीज़ में मिलती है, वो कभी भी आपको वेबसाइट पे नहीं मिलेगी। दूसरी ब्रेनवार वो है जो सिरप फॉर्म में है, शुगर फ्री है। तीसरी ब्रेनवार वो है जो अगेन सिरप फॉर्म में है लेकिन शुगर फ्री नहीं है। चौथी ब्रेनोवार जो है वो माइल्ड वैरायटी की ब्रेनोवार है। पांचवी ब्रेनोवार कंसंट्रेटेड। सिक्स्थ ब्रेनोवार डीएस। सो ब्रेनोवार कई तरह की है। मेरी आपसे रिक्वेस्ट है, बिना डिस्कशन किए हुए आप अपने आप से ब्रेनोवार मत लीजिए। ये कोई टॉनिक नहीं है, टॉनिक होता तो ये आपको 200-300 रुपए का मिल रहा होता। ये एक हाईली कंसंट्रेटेड आयुर्वेदिक कॉम्बिनेशन है जो भले ही आपके बच्चे को नुकसान नहीं करेगा अगर आप कोई गलत तरह की ब्रेनोवार भी ले लेंगे, लेकिन फिर फायदा भी नहीं करेगा। आपको लगेगा इतनी एक्सपेंसिव सिरप ले रहे हैं, हमें रिजल्ट्स नहीं आ रहे हैं। तो आपके बच्चे की नीड के अकॉर्डिंग हमारे डॉक्टर्स ये डिसाइड करते हैं कि कौन सा ब्रेनोवार आपके बच्चे के लिए लाभकारी है। प्लीज आप अपने आप से इसे चूज मत करिए। और सबसे बड़ी बात, जैसा कि मैंने आपको बताया, ये चॉइस, ये डिटेल आपको बताने के लिए हमारे डॉक्टर्स फ्री ऑफ कॉस्ट बैठे हैं आपकी सर्विस में। तो फोन नंबर आपके सामने है, फोन लगाएं, डॉक्टर से डिटेल लें और फिर ब्रेनोवार लें, फिर रिजल्ट्स आपको जरूर मिलेंगे। जी।
राइट सर। सो हमारे साथ जिया जिसान है, ये मेंबर है सर 1 महीने से। हेलो सर, मैं जिया हूँ, रेयान की मदर। मेरा क्वेश्चन ये है कि सर पिछले 4 मंथ की ट्रीटमेंट ले रहे हैं, बच्चे में इम्प्रूवमेंट्स भी दिख रही हैं। मैं पूछना चाहूँगी कि और प्रोग्रेस कितना टाइम लगेगा और कितना टाइम लेकर चलें। हाँ, और अगला स्टेप क्या गाइड करेंगे आप सर? ऑटिज्म अगर कमांड फॉलोइंग आती है, आइडेंटिफिकेशन है, स्पीच कब तक आ जाएगी? वी आर वेटिंग फॉर रेयान स्पीच फॉर सो लॉन्ग सर, प्लीज़ गाइड सर।
ये एक बड़ा कॉमन क्वेश्चन है जो डेफिनेटली हर पेशेंट के जहन में आता है। और जब पहले कुछ महीनों में पेरेंट्स ये देखते हैं, सबसे पहले तो जब फर्स्ट टाइम कोई हमारे साथ जुड़ता है, बहुत बार ये विश्वास करना मुश्किल हो जाता है पेशेंट के लिए कि हाँ आयुर्वेद काम करेगा, साइकोथेरेपी काम करेगी। तो 50% लोग जो हमारे पास आते हैं बिलीफ ही नहीं बना पाते और हम बिना बिलीफ के इलाज ही नहीं शुरू करते हैं, क्योंकि जब तक माँ बाप का विश्वास नहीं है, फैमिली का विश्वास नहीं है कि मेरा बच्चा ठीक हो जाएगा, बच्चा कभी ठीक नहीं होता। लेकिन जो पेरेंट्स विश्वास करते हैं, जैसे आपने किया, हर पेरेंट को मोस्टली पहले 6 महीने में अच्छे रिजल्ट्स मिलते हैं। टोटल समय कितना लगता है, कुछ फैक्टर्स पे डिपेंड करता है। साइकोथेरेपी सेशंस की आपकी फ्रीक्वेंसी क्या है, ये मायने रखती है। क्या आप चंडीगढ़ आए, आकर के आपने सीखा और इलाज किया, उससे क्विकनेस बढ़ जाती है। बच्चे की एमआरआई कैसी है, नॉर्मल है, कोई एबनॉर्मेलिटी है, इस पे डिपेंड करता है। आप बच्चे को किस एज में हमारे पास लेकर के आए हैं, इस पे डिपेंड करता है। लेकिन अगर आप मुझे मिलते हैं, अगर फेस टू फेस हमारा कंसल्टेशन रहता है मेरी किसी ओपीडी में, तो मैं जनरली इन सारे फैक्टर्स को ध्यान में रखते हुए और पेरेंट्स पे विश्वास करते हुए कि जो मैं बताऊंगा वो पेरेंट्स करेंगे, पेरेंट्स को हमेशा एक टेंटेटिव टाइम देकर चलता हूं, और वो परमात्मा मेरी वहां लाज भी रखते हैं। और जितना टाइम कमिट किया होता है, इन मेजोरिटी ऑफ द केसेस वी आर एबल टू गिव रिजल्ट्स मच क्विकर देन व्हाट आई इनिशियली प्रॉमिस टू द पेरेंट्स। सो आप समय निकाल सकते हैं, बहुत जल्दी हम चाहते हैं कि बेटा जो बोले, तो मैं कहूँगा समय निकाल करके आप हमारे पास आ सकते हैं, फिर तो बहुत ही क्विक हो जाएगा। जी।
Right, so thank you, sir. Thank you for guiding, sir. So we have a lot of questions back to back from our viewers, and they are
But
having.
Gaurav ji, we will be able to take the last question now because time is not allowing us. So it will be the last question for the day which we will be asking now, and then we will be taking a goodbye from our viewers for today. Yes, Gaurav ji.
Right, sir. So mostly when sir parents, one question from my side, sir. So mostly parents wants to know that till how long we have to continue with the ABA sessions as our treatment guided by you, sir, for some time, for 2 years or 3 years. So they have to continue ABA sessions even more than that time, or they can stop after
The
that.
parents should remember that it will be the herbs which will be stopped firstly and then ABA. The ABA sessions will carry on longer than the herbs which are being given to your child. The herbs are basically making the ABA possible. So when a stage comes when the child is 70% all right, now we do not require support of herbs. We will stop the herbs gradually, but the ABA will still carry on. And in some cases, depending upon the age of the child, we will need a greater frequency of ABA sessions at a higher age. So please do remember, it's not the normal ABA which you are doing at your own home. When I say ABA, when I say applied behavior analysis, always remember it is not the psychotherapy which is being done near to your home. It is something which we have developed exclusively with the extensive research of so many years, with the dedicated effort of so many years. And this is the ABA, which is Ayurveda synergized ABA, a non-command based ABA protocol where we train the parents and we get things done from them. So please do remember, don't confuse ABA for the normal psychotherapy centers, therapy sessions which you are getting done for your child. Always remember, and this is something which I always quote to all my patients, all the parents. I know the hardship which you face in traveling with your autistic children to me. I know it's not tough to travel with a child, whether with autism, or travel with a parent with Parkinsonism, or travel with any patient. And I really admire that you cross the globe, you cross the countries, and you still visit us. And that's why मेरी जिम्मेदारी बढ़ जाती है. That's why it is my responsibility and it is my promise to you. If God gives a chance and we ever meet, you won't repent your decision. Me and my team will always give it our level best. So, God bless you all with good health. Stay happy, stay wrist pushed, and do not forget to like our video. Do not forget to share our videos. That really means a lot to us. Thank you.
कुमार है, मैं कानपुर से यहाँ आया था ऐसे ऑलमोस्ट 1 महीना पहले। तो मेरे को इमरजेंसी में आया था, तो मेरे से चला नहीं जा रहा था। पार्किंसन का इतना ज़्यादा प्रभाव था कि मैं अपना बिना स्टिक के एक कदम भी नहीं मूव कर सकता था। रास्ते में देखा जब यहाँ इस हॉस्पिटल में मेरे को लगा कि आयुर्वेदिक पंचकर्मा का करके मैं अंदर आ गया। तो मैं सबसे मिला डॉक्टर शोरूम से, इन्होंने मुझे काफ़ी भरोसा दिलाया। उन्होंने ये बताया कि आप यहाँ ट्रीटमेंट लो, पंचकर्मा का ट्रीटमेंट भी है और आपके पास फिजियोथेरेपी का भी है। तो हर तरह से इन्होंने काफ़ी मेरे को मोटिवेट किया और वो मैंने इनकी बात को फॉलो किया। कंटिन्यूस जो इन्होंने बताया वो मैं पंचकर्मा के ट्रीटमेंट थेरेपी कराई है। अभी आप देख सकते हैं कि अभी मैं जैसे स्टिक के साथ चल रहा था, आज मैं बिना स्टिक के तकरीबन यहाँ का ट्रीटमेंट के साथ, तो मेरे को काफ़ी अभी कॉन्फिडेंस भी आया है और काफ़ी अच्छा रहा। यहाँ का स्टाफ बहुत बढ़िया है, जिन्होंने मतलब जो मेरे को पोटली मसाज या कोई सिर्फ बॉडी मसाज या शिरो वस्ती वगैरह का जो इन्होंने किया है, बहुत ही लगन और प्यार से किया। जो लड़के हैं, जो स्टाफ है, बहुत ही इज्जत और मतलब के साथ मतलब लेके जाते हैं, लेके छोड़ते हैं गेट के बाहर। और मतलब जो है मेरे को तो बहुत ही फायदेमंद लगा ये ट्रीटमेंट यहाँ पर। तो मेरी कोशिश रहेगी कि इन फ्यूचर लाइफ में मैं यहाँ जरूर आता रहूँगा रेगुलरली चेकअप के लिए और साथ में पंचकर्मा ट्रीटमेंट के लिए। इसके दौरान मेरे को कुछ डाउट थे अपनी बीमारी के लिए, तो डॉक्टर यहाँ पर ND नवदीप शर्मा सर आए थे। तो स्पेशली उन्होंने मतलब अपॉइंटमेंट दिया, अपना वैल्यूएबल टाइम, उसको मतलब मैंने उनको सारी बात बताई है। तो काफ़ी उन्होंने मुझे चीज़ें जो है, तो मेरी गलतफहमी थी रिगार्डिंग माई ट्रीटमेंट, वो भी उन्होंने काफ़ी क्लियर किया और उसी अकॉर्डिंगली मेरे को आयुर्वेदिक मेडिसिन प्रिस्क्राइब करी। तो मैं उनको भी ले रहा हूँ साइड बाई साइड। मैं अपना आयुर्वेदिक ट्रीटमेंट में चल ही रहा। यहाँ आना मेरे लिए तो बहुत ही मतलब अच्छा एक्सपीरियंस रहा। मैं तो चाहता हूँ कि बाकी आने वाले समय में जो भी लोग आते हैं, पेशेंट आते हैं, इसी तरह से उनको भी ये सेवा देते रहें, लोग ठीक होते हैं।
Condition of the patient when she approached us for Parkinson's treatment. She was completely bedridden and on an Ryle's tube. She started our treatment and after 22 days, she started to respond to our treatment. Her Ryle's tube was removed and she was able to eat and drink by herself. During the second month of treatment, her condition improved drastically. With our treatment along with our specialized diet plans and yoga exercises, she was able to walk with the help of support and sit on the chair on her own. Now in the third month with our treatment, she is even able to do some household chores on her own.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding.
History of patient.
The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
Hello?
आ जाएगा वो। कलर करो, वेरी गुड पार्ट, कलर करो। नो, इस हैंड से कर, वेरी गुड। इसके अंदर रख दो, वेरी गुड। पापा ना हैंड, दीदी का हैंड करो। Hello parents, Parth, say hello, say hello. This is Parth, my son, he's about to turn 4 years old. Last year in July we went to Dr. Navdeep Sharma sir. A sir had told me about him. We never imagined that in just 9 months Parth would start saying mama and papa to us so soon. As a mother, as parents, we always longed for the day when we would hear Parth say mama and papa. Today Parth says mama, papa and everything else with understanding. By God's grace and with Sir's medicine and guidance, in just 9 months, Parth is now living a near normal life. And Parth was also in playgroup at school. Just 15 days ago, the teacher at school said that Parth will be moved to nursery, and the happiness that Sir has brought into our lives, what more could parents ask for than to see their child improve so quickly and so well? For parents, this is truly a big thing. Thank you, Sir. Thank you very much for bringing such